Good afternoon and good morning to some of you, depending on where you're located, and welcome to today's webinar, Culturally Inclusive Healthcare, Honoring Traditions for a Healthier Tomorrow. We are delighted to have you join us as we explore and implement strategies that enhance patient care and outcomes by integrating traditional healing into healthcare models. With a profound commitment to cultural sensitivity, evidence-based support, and measurable impact, this event empowers healthcare professionals to create a more inclusive and holistic healthcare landscape. Today, we are here to help facilitate this discussion between traditional and modern healthcare practices to make healthcare more culturally inclusive and patient-centered. My name is Liz Best, and I'm a program manager of technical assistance with the Technical Assistance Research Center here at NCUE. And joining me from my team are Molly Siegel, a public health associate, and Jessica Gilbertson, Director of Communications, Event, and Community Engagement. We kindly ask that you place your name, your organization, your tribal affiliation, and title into the chat box. In addition, we welcome any feedback you would like to provide about your webinar experience in our survey, which will also be posted in our chat box. Next slide, please. For those of you that are unfamiliar with NCUE, here's a little background. The National Council of Urban Indian Health, also known as NCUE, is the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indian and Alaska Natives living in urban areas. NCUE is the only national representative of the 41 Title V Urban Indian Organizations, or UIOs, under the Indian Health Service and the Indian Healthcare Improvement Act. NCUE strives to improve the health of over 70% of the American Indian Alaska Native population that lives in urban areas, supported by quality, accessible healthcare centers. Next slide, please. Today's event is made possible by Indian Health Services Cooperative Agreement Funds. This event is solely the responsibility of the National Council of Urban Indian Health and does not necessarily represent the views of Indian Health Services or the Department of Health and Human Services. Next slide, please. Before we proceed, please note that this session will be recorded for educational and quality improvement purposes. This recording will also be shared to make it accessible to those who may have missed it or would like to revisit the content at a later date. We will also be sharing the slide deck via email next week. Next slide, please. Everybody's mics have been muted upon entry. We always encourage participation and engagement, and we invite all the participants to turn on your camera and post questions and comments in the chat box. There will be an opportunity for questions and answers at the end of the presentation. Next slide, please. As we continue our webinar, we encourage active participation and we value your questions and insights. To make the most of this interactive experience, here is how you can ask a question. Just click on the chat icon below and type your question and hit enter to send it to the group. Next slide, please. Our learning objectives for this webinar are designed to ensure that you come away with valuable knowledge to inform your community members. By the end of this session, you will be able to explore effective ways to integrate traditional healing practices into contemporary healthcare models while maintaining a strong emphasis on cultural sensitivity and patient preferences. You will be able to share evidence-based support for traditional healing practices in healthcare, emphasizing their role in patient care. Identify key metrics and assessment tools to measure the effectiveness of culturally integrated healthcare initiatives and their impact on health outcomes. And lastly, empower healthcare providers to become advocates for culturally inclusive policies and practices within your respective organizations. Next slide, please. So we're so pleased that Nala Holland, Danelle Tradier, and Andrea Clements could join us today to share their knowledge. Nell is the Senior Director of Operations and Residential Treatment for Native American Connections. She brings over 20 years of experience in the healthcare field with an emphasis on behavioral health and addiction. Danelle has a Master's of Business Administration degree from the University of Phoenix and a Bachelor's of Science degree in Criminal Justice and Psychology. In her career, she has worked in both inpatient and outpatient hospital settings. In addition to opening 2 residential treatment facilities for Native American Connections. She has been with Native American Connections for almost 9 years with the development and licensing of both Patina Wellness Center and Patina Mountain Preserve, as well as assisting with the outpatient program and the integrated clinic. Andrea is the clinical director of Native American Connections, Patina Wellness Center, residential substance use treatment facility serving women, couples, and families. She is an enrolled member of the Oglala Lakota tribe and has a master's in addiction counseling from Grand Canyon University, a bachelor's in psychology from Arizona State University, and is a licensed independent substance abuse counselor with the Arizona Board of Behavioral Health. She has worked in alcohol and substance use treatment and recovery for 10 years at Native American Connections in both outpatient and residential programs, supporting both evidence-based and traditional teachings with emphasis on intergenerational healing. And lastly, we have our very own Nala Holland here. She is an enrolled member of the Eastern Pequot Tribal Nation and serves as a research associate at NCUE. Before NCUE, Nala worked in research on cross-cultural presentations on mental health and illness and in microbiology. At NCUE, Nala works to support NCUE staff by providing and analyzing relevant data, sharing research considerations when collaborating with Native American populations, designing research projects, and much more. Currently, her work has focused on the importance of traditional healing and the use of Native American ceremonies and activities as healthcare at UIOs. Please place a welcome emoji in the chat box. And without further ado, the mic is all yours, Nala.
Hello, everyone. If we could go to the next slide, thank you. So I'm going to be sharing some of the recent work that NCUE and I have been doing in the realm of traditional healing this past year. So we recently just finished up a report on traditional healing in collaboration with the University of Chicago North and CMS, and it had two parts, both on traditional healing. One was focused on qualitative data and one was focused on quantitative data. So the quantitative data component was a meta-analysis of recent literature on the effects of traditional healing on health outcomes in research settings, and then we had a qualitative component that was 8 UIO interviews on those UIOs, traditional healing programs, and their ability to bill Medicaid for those programmings. And I'm not really going to focus on the finance part for this, but if you have any questions, please feel free to let me know at the end of it. And I do want to point out that often Western research models focus and prioritize and value the data, the numbers, the quantitative component of research, but keeping in mind we want to use that indigenous framework of research and really value and also bring light to the stories and that indigenous knowledge that can't always be quantified in the way that Western research wants us to be. So we try to really highlight the stories and the narratives of UIOs with these interviews. And I'm going to share what we found out and what we learned from them. So next slide, please. So going into this, we were using the definition. We were defining traditional healing through a culture's prevention model, and that would be summed up by the use of culture and cultural activities and experiences to restore and maintain health of not just the individual, but of the overall community. And so this is a focus on the maintaining of wellness, prevention of illness, which is different compared to that Western model of medicine that kind of focuses more on the treatment of existing ailments. And what's unique about the culture's prevention model is that it was actually developed by UIOs through a SAMHSA-funded project to indigenize substance use and mental health prevention in Indian country. And so it allows us and UIOs this flexibility for a multi-tribal definition of traditional healing that recognizes the overall commonalities across traditions throughout the different tribes, but also acknowledging that there will be variations from tradition to tradition, from tribe to tribe. But overall, there is that presence of culture is the overall healing factor and protective factor. And overall, it's going to have its benefits, even if there's a few differences. And so in the UIOs we talk to, they're either explicitly using this model or they're implicitly using culture as these protective factors in their healthcare settings. And one thing I always like to start this presentation with is this quote from the Minnesota Department of Health saying that traditional healing for American Indians has outcomes equivalent to conventional interventions in other populations. And I think this really hones into the point that there's evidence, whether it be through generational indigenous knowledge, through a meta-analysis, through interviews with UIOs, whichever way you're getting your information, there is that evidence that traditional healing is effective and it should be valued when it comes to healthcare settings, and it should be considered healthcare despite what anybody may say. The evidence is there. Next slide, please. And so I like to provide this overview of UIO services in traditional healing programming. This is all pulled from UIO websites in 2022, and I think it gives a good overview. When I say cultures prevention, I mean everything that's going to be considered cultural. So native language lessons is considered traditional healing just as much as traditional medicines and talking circles. So this really offers you kind of a snapshot of the variety of programming that UIOs have the ability to provide their patients in the community. Next slide, please. So there's a lot of programming that UIOs do around traditional healing, but we couldn't focus our interviews with those UIOs on all of those topics. So we honed it down to talking circles, sweat lodge ceremonies, and smudging, which were three very common interventions offered at, or activities offered at UIOs. And so we picked that based off the commonality, and we structured our conversation with UIOs around those topics. But in our conversations, UIOs were showing us or sharing with us their programming around traditional diets and foods and their indigenized substance use recovery programs. And we learned so much from that in our conversations with UIOs. We would really be leaving out a significant portion of our conversations if we did not add those to the report after the fact. So we made sure that we also focused on that when it came to the final write-up of the report. I'm not going to get into each specific intervention in this presentation. Molly's going to be sharing in the chat soon a link to a one-pager that goes into benefits from the literature of each intervention. So anybody ever tries to tell you, well, this isn't supported by evidence or by the literature, you have that ready to go. You have that receipt ready to go. But yes, next slide, please. So UIOs are utilizing pan-tribal traditional healing activities to sustain cultural connection and enhance community wellness in their multi-tribal urban native communities. And this is really important as urban native people are often away from their tribal homelands and their culture and connection. So UIOs are sharing with us that patients expressed to them that their only point of culture was the UIO themselves. So they're offering that cultural connection, which is very necessary for this population, and giving them a sense of community so they're not so isolated and lonely out in these urban areas where there's less native community, perhaps. And traditional healing offers a holistic approach to health, which is unique compared to Western medicine that kind of focus on just a physical ailment. This holistic approach to health is used for all patients at UIO. So yes, you can go in to a UIO and request a specific service, and a provider with their education on traditional healing may suggest a certain ceremony based on a condition, but traditional healing is integrated into all aspects of care at a UIO. So as soon as you walk into one UIO, for instance, they will have smudge readily available for you if you want to take that into an appointment with you, or if you want to take that home with you even. some UIOs will have calming flute music playing on speakers when you're in a waiting room to kind of alleviate some of that anxiety that might be present when entering a healthcare setting. And so it's a focus on not just what you're going into. You may be entering a UIO for a specific condition, but they're going to treat everything, not just that specific condition. They're going to treat the whole person, and it's that focus on the medicine wheel and all aspects of health. And one thing that UIO shared with us, which was so great to learn so much about, was that UIOs have several community outreach programs where they utilize traditional healing to make sure that people that aren't a patient at a UIO, may not even be aware of a UIO, may not have access to a UIO, are still going to be able to get that traditional healing. So they have programs with people that are currently incarcerated, with local hospitals, if you want like a smudging ceremony, for example, while you're in a hospital, or people who are experiencing homelessness and things like that. They offer that traditional healing for those people, even if they're not in their UIO or a normal patient of the UIO. And as I've kind of mentioned already, that traditional healing is incorporated into all aspects of care at a UIO. It should not be confined. Traditional healing should not be confined to behavioral health treatment. This was really a problem we were hearing in terms of billing. Sometimes billing coding would require that traditional healing encounters be counted as a behavioral health encounter. So, for example, one that came up was talking circles, where it had to be billed as group therapy. Those are not the same thing. They should not be considered the same thing. They should not be billed as the same thing. It's completely culturally inappropriate to think of them as the same thing. It's to suggest they're the same thing. And so it's really important that when we're talking about traditional healing, we're acknowledging as its own entity in healthcare. It's not just grouping under behavioral health. Next slide, please. And so I'll go over some of the benefits and uses of traditional healing overall, not for like specific interventions. So I already mentioned it's great for enhancing preventative care. So maybe you have like the start to like a bad knee or something. Instead of it going straight to medication, maybe you can attend some sweat lodge ceremonies and try to go from there. And then it's also really great for combating loneliness and isolation and increasing that cultural connection that's necessary for this urban population. Loneliness and isolation are often overlooked by Western approaches to medicine as a risk factor for health and wellness. And UIO shared with us that the loneliness and social isolation of urban Native people is often exacerbated by being disconnected from their culture and ostracized in the cities. So the traditional healing programming offers that cultural connection and community of alike individuals going through the same thing, that same cultural isolation and ostracization, and allows them to treat that historical trauma along with the other health issues they might be present at a UIO for. And that's something unique to traditional healing, is that it's going to specifically address the historical trauma unique to our Native population. And that's not something that Western models of medicine were built to address. And so you may be receiving great care, but if it's not addressing the historical trauma in you or in a patient, it's not treating the whole person. And so you're not still able to reach that level of wellness that you should be able to get if you were receiving treatment also, or not treatment, but if you were addressing that historical trauma in an individual. Next slide, please. All right, so now I'm going to get into the meta-analysis, the number part, the data part for all you math people. So quick overview of what a meta-analysis is. So we're all on the same page, is that it's a overview of it's like a literature review, but you can only use quantitative articles, and it summarizes all the outcomes of those articles and tells you overall, is there significant in the effect of traditional healing for health outcomes. So that's what we did. So next slide, please. So we did a literature review using 3 databases from 2000 to the very end of 2022 when we started this project. And the reason why we chose 2000 was because that is when articles started to be published online in place of being published in a book. So it's more continuity in terms of articles consistently being online. And these are some of the search terms we used to make sure we were picking up articles that we wanted on traditional healing. Next slide, please. And this, we started with 15,000, nearly 15,000 articles, a whole lot. So we got, obviously not all of them were relevant to us. So we had some inclusion exclusion criteria. So we included articles about traditional healing practices of Indigenous peoples of the 48 contiguous United States, Alaska, and Canada. And the inclusion of Canada is because we recognize that culture is not limited to the modern borders of the globe. So obviously we shouldn't just be excluding literature on traditional healing practices because they took place in Canada, and it still might be relevant to our populations within the United States. And then so we had to exclude articles that were in Central America and Mexico because of language barriers, even though they might still have that same cultural traditions with tribes in the United States, but due to language barrier, they had to be excluded. And then other areas of the world, different cultures, so they were included. And then, unfortunately, we had to exclude a number of qualitative outcomes, articles focused on qualitative outcomes because they did not have the data that we needed to run a statistical analysis on it. So they could not be included. Next slide, please. So we started with nearly 15,000 articles. We ended up with 19. A little disheartening, but you have to work with what you got. And so we did a few analyses, one being we looked at all 19 articles and looked at the general effect of traditional healing on any health outcome. Then we looked at mental health outcomes, substance use outcomes, and physical health outcomes. So for the general effect of traditional healing on health outcomes, for all health outcomes, we saw medium to large effect size, which means effect size measures the practical significance. So would this be relevant? Would this be significant in a non-research setting? And so medium large effect size is typically what you would see for other medical interventions. So we're on track for that for the general effect of traditional healing. Next slide, please. Mental health outcomes showed a large effect size. So again, showing that practical significance and demonstrating that traditional healing supported the literature. And that included some interventions such as talking circles, squat lodge ceremonies, and traditional food interventions. Next slide, please. And then we had the substance use meta-analysis. So that showed that traditional healing interventions for substance use cessation had almost 3 times higher odds of success compared to the control group with substance use cessation. And a lot of that is contributed to one article from Native American Health Center out in Oakland, where they saw after inpatient treatment, patients there were 90% less likely to have used alcohol or drugs in the previous 30 days when using a traditional healing intervention for substance use. And then unfortunately for physical health, we only had 3 articles for that, and it was the software was unable to detect effects in physical health. So, but again, we only had 3 articles that were relevant to physical health outcomes. So it illustrates the need for research around traditional healing efficacy with larger populations, and of course, culturally, with researchers that are culturally aware and trained in traditional healing to know what is sacred and what is appropriate to be measuring. Next slide, please. So overall, this report is showing that, traditional healing is effective. It should be integrated into healthcare, is healthcare itself. And this report soon will be posted on our website. Molly will be providing a link in the takeaways from this presentation to where to find this report when it is published on our site. She's also going to be providing a PDF of a poster we presented at NAHB symposium on this report, where it'll summarize the report a little in some more detail for you to hold you over until the report is published on our website. And going forward, we are continuing this traditional healing work at Nukuri. We're going to do some more interviews with UIOs on the traditional food programming, and we're hoping to continue to look into some of those articles we had to exclude from the meta-analysis because they were qualitative in nature. And so we're hoping to look into those and do another literature review on that, specifically on literature that was done in collaboration with UIO, so we can highlight some of the efforts there. And that is all from me. I will take your questions later, and I will pass it off to the next.
Hi, my name is Danelle Trottier, and I am the Senior Director of Operations at Native American Connections. I oversee both of the residential treatment centers. I am originally from North Dakota. My family origins are German, Norwegian, and Scottish, but my husband and daughters are members of the Turtle Mountain Band of Chippewa Tribe in North Dakota.
Good morning. I'm Andrea Climas. I am Mexican. Maternal origins come from Zacatecas, Mexico, and I am a citizen of the Oglala Lakota Nation in Pine Ridge, South Dakota. I currently reside here in Phoenix, Arizona. Native American Connections is here in Phoenix, Arizona, on the ancestral lands of the Atam and Pipash people. Next slide.
Native American Connections has been around for over 50 years. NAC was known as Indian Rehabilitation and started out in a small house in the middle of Phoenix as a substance use treatment center serving only 16 men. NAC is an urban Indian organization and has grown significantly, but our mission has remained the same. NAC's mission is improving the lives of families through Native American culturally competent behavioral health, affordable housing, and community development services. Next slide.
So here at Native American Connections, we acknowledge the intergenerational trauma that has gone on and transition that focus to intergenerational healing. So part of that trauma is that we often see coming in for our members seeking substance use treatment is the removal from the family environment, either through boarding school history, incarcerations, social services involvement, and the substance use. And addressing it through the culturally appropriate services is that transition into the intergenerational healing. Next slide, please.
Natural methods for healing. Some of the methods we use, Red Road to Wilbrady, Talking Circle, Smudging and Prayer, Positive Indian Parenting, Healthy Relationships, Gathering of Native Americans, Cultural Arts, Songs and Drumming, Sweat Lodge Ceremony, Gardening, and Keeping the Families Together. Next slide, please.
So here we have Native American Connections has 2 sweat lodges, one at each of our residential treatment facilities. So that is Patina Mountain Preserve, which serves primarily men, and Patina Wellness Center, which serves women and families. So families can be couples, keeping the couples together, and with their children, whether they're coming in as mom and dad or as a single parent with their child. Keeping that intergenerational healing concept in mind, by providing family substance use treatment services to keeping the families together. Goes back to the origin traditions of all the tribal nations of community and family as the core. So here we have our residential sweat lodges here, where we've collaborated with the city of Phoenix. They allow us to go down and make our offerings, our prayers, and they assist us with harvesting the willows. Together, both residential sites, along with our cultural service providers, our clients, our staff, will come together and understand the teachings and the fostering of rebuilding, tending to, caring for our lodges. Our sweat lodges are available to our active clients, their family members, and staff. Mentoring is throughout this whole process of the sweat lodge in unity, support, healing, that cleansing as they're entering this intergenerational healing of recovery. Next slide, please.
In building around community, Native American Connections participates in Native American Recognition Days and hosts a parade every October. Community members near and far participate in the parade. All of NAC's departments create floats, and both clients or residents and staff work together to proudly show off their creation. Next slide.
Expanding on the community involvement, traditionally we know it takes a village to raise a person, and we are all healing. And so we utilize our community supports. Our sports teams, the Cardinals, have come and worked with our youth at our housing developments. Our collaboration with our schooling entities, Arizona State University, Grand Canyon University, University of Arizona, Midwestern University, and different components. That's building upcoming professionals through social work and counseling, working directly with our members in financial education, health education, nutritional, all with an understanding of whole body wellness, whole being wellness. The photo to the right is from our Phoenix Indian School Visitor Center. We do have a gallery there sharing the history of the Phoenix Indian School boarding school that's been around, was around, active for 99 years. It is also open and available to the community and bringing the community together. Next slide, please.
An overview of our services. NAC provides the entire continuum of care. We have adult substance use outpatient services, which include an intensive outpatient program, a community AA meeting, and a sober living home for men and women. We have 2 residential substance use treatment centers, Patina Wellness Center, which serves pregnant women, single parents, families with dependent children, couples, and two-spirited individuals. We have Patina Mountain Preserve, which serves men and two-spirited individuals. We also have an integrated medical behavioral health clinic, housing, affordable workforce housing for families, as well as permanent supportive housing. In addition, we have transitional housing and 2 youth shelters. And lastly, we do a lot of community development, and that includes our partnership with the City of Phoenix to operate the Phoenix Indian Visitor Center, which captures the history of the boarding school and allows for both an educational setting, but also a place to host meetings, cooking sessions, and other community events. Next slide, please.
So our behavioral health services are about assuring client success with our integrated health model. Intergenerational healing benefits the whole family treatment and substance use disorder services. utilizing evidence-based practices combined with native culturally appropriate practices, such as talking circles, smudging, sweat lodge, in taking that trauma-informed, person-centered approach. Understanding that substance use, there typically is some level of trauma associated with it, and that is the means to self-medicate. And through these traditional components, traditional teachings, mentoring, we're able to offer that healing. And we are a UIO here in Phoenix, Arizona, and we serve all of our relatives here. Next slide.
NAC's fiscal year data outlines the clients served. NAC prioritizes Native American substance users, pregnant and parenting women, and IV drug users, but we do serve everyone. 55.26% of our population served identify as American Indian, Alaskan Native. 21.05% identify as Caucasian or white. 7.89% identify as Black or African American. 1.75% identify as Asian or Pacific Islander, and 14.04% selected other in the categories. Next slide, please.
So the clinical approaches here at Native American Connections are outpatient and a residential treatment sites. We're expanded to support a client where they are at, with a focus and emphasis on safety, overall wellness, and functionality. Meeting the client where they are at is individualizing their program to them, taking in their strengths, their personal goals, their intentions, whether it's harm reduction, family involvement. We address it with compassion and empathy, combining the traditional components and teachings in with the 12-step methodologies. Living in Balance curriculum helps to create that mindfulness-based relapse prevention plan that is going to be effective in working for that member when they transition and step down to the next level of care, whether that's at outpatient here at Native American Connections, or within their local community, should they decide to go back home in the rural setting. Finding that prevention plan that is going to work with them, with the coping skills that they've developed throughout here. Clients also have that opportunity to share their feedback with us and how we can improve or adjust our program to meet the needs. And they do that through our client satisfaction survey. Next slide, please.
As Andrea was saying, NAC gathers feedback from both clients and staff in an effort to continue to improve services. We do this through client surveys, staff surveys, completion rates, and client testimonials. Of the clients surveyed, 97% would recommend services with Native American Connections. 98% of clients believe the cultural aspect is the most important part of treatment. And our graduation rate or completion rate is about 85% from programming. Next slide, please.
So a few of those client testimonials from this last quarter. I really found my inner soul, and I am happy that I attended the program. NAC helped me to get my children back, and now I can leave treatment sober and with my children. I learned coping skills on how to cope with my past trauma. Thank you, NAC staff, for your help. I really enjoyed the sweat lodge. It helped me to find my spirituality again. NAC was a great experience for me. My clinical team was very helpful. The daycare provider was wonderful with my child. She gave me resources to help me be a better parent in my recovery journey. That photo there is at our men's facility, our Patina Mountain Preserve. And we had to rebuild our lodge in the middle of June. For those that are unaware, in Phoenix, Arizona, in the middle of June, the temperatures are 110 plus. But as a community, we came together, worked together with the elements and respecting of those elements to create that space there. Next slide, please.
And these are just some of the fun things we do, integrating cultural traditions and wellness. You can see talking circle, games, hiking, drumming, a daily smudge, a patina runway, and then of course, sweat lodge ceremony. Thank you for taking the time to listen to what we do to serve our population. Thank you.
Thank you.
Great. Thank you, Nala, for sharing all the great work that you're doing, and Danelle and Andrea for sharing the great work that you're doing in your communities. And with that, we will open up the floor to questions and answers. Feel free to unmute yourself, or if you prefer, you can type a question into the chat box. I guess my one question that I had, Nala, when doing your meta-analysis and the work on your report, what gaps in research did you see, and are there any areas where you think more research can be shared and done on different programming?
Yeah, I mean, I think the numbers speak for themselves. I didn't show the exact numbers, but again, we started with nearly 15,000 articles that were pinged for meeting some of our search terms, and then we ended up with just 19 for the past like 23 years. So there needs to be a way to figure out, to conduct research on traditional healing to show its efficacy, but do it in culturally aware ways with staff and researchers that are trained in traditional healing, are aware of it, are part of the community, so that it is being done in mindful ways and it is acknowledging the sacredness of these traditions, but also appeasing people that want that data, those numbers, in place of the generational knowledge that we know of these practices. Specific areas, I think every area really needs it in terms of traditional healing, but physical health, it seems to be hard to find, specifically on physical health, to find research that was directly addressing that and figuring out ways how to quantify that while maintaining, one problem with doing research with traditional healing is that it's really sacred. And so it's not always appropriate to be going in and doing research on it. So it's going to take a lot of time to do these research to make sure that everyone is being respected when it's being done, but it's definitely worth doing, and you shouldn't be, put off by that. It's going to take time and that effort.
Great, thanks, Nala. Another question that just came into the chat for Danelle and Andrea. Do you have local tribes ask about your programming?
We do. We actually contract with local tribes and also out of state tribes as well.
Great. Do you work with IHS 638 facilities, notably PIMC?
Yes, we do. We also have a contract with Phoenix area IHS and Albuquerque area IHS, but we do a lot of coordinating and referrals with Phoenix Indian Medical Center. Yes.
Great. Another question that came in, are there contractual opportunities for traditional healers?
Yes, so we do have contracts with some of our cultural providers that facilitate sweat lodge, both male and female.
Great. Great presentation, NUC leaders. Can you please share briefly how you also integrate medical care and coordinate care for patients when they have PCPs at PIMC, Gila River, etc.
I'm going to go ahead and let Andrea handle this one.
So yes, we do coordinate with them. We want to, again, promote the whole person, their whole team, breaking away from that trauma if we keep everybody separate. And so trying to rebuild that trust, and we're all here to work together to support. So we do have a really good relationship with Phoenix Indian Medical Center. We have a really good working relationship with Gila River Indian community. They are kind of the more close to us, and so we do a lot of work with them and their teams, and collaborative, very much so. So we do and try and include and involve and connect as much as possible.
Great. Another question, how do you recommend healthcare providers incorporate more traditional healing methods into their patient interactions? And I guess also, do you, do you ask the patient if, this treatment is something that they would like more of the cultural?
So yes, that is covered at the beginning. When the first person first comes in to engage in services, they're educated on our cultural services here. It is just another form. It is another way. So we ask clients that may be new to these ways to just be open-minded. And if, again, what are their preferences? What is their cultural foundation, their spiritual foundation? There are similarities, and we are very mindful as an UIO that each tribal nation handles things a little bit differently, and so we are respectful of that. And most of the time, members that come in that have totally disconnected from whatever their spiritual cultural foundation was, rejuvenate, and they're reinventing themselves. They're re-identifying who they are as a sober person, as a person in recovery, as a person healing, that they're able to take with them what is speaking to their spirit.
Great, thank you. A question for Nala. Great job on the meta-analysis. Do you have specific plans for next steps in the research?
Yeah, so for the meta-analysis, we are still trying to get it out there and published, but we do hope to further publish it out in some journals and things like that. We also plan to go do some more presentations at summits around traditional healing, around Native healthcare. We have already presented it to CMS and to the Office of Minority Health. We want to make sure that this information is getting out there to the people that want it. We specifically, I didn't mention a lot about the finance part, but so some states are able to bill for traditional healing. Sometimes, in theory, they're able to bill for traditional healing through a Section 1115A waiver through and some states are in the process of getting one for traditional healing. And so we hope to provide this evidence to those states to further push for traditional healing to be funded and for UIOs to be able to bill for the traditional healing programs. And in terms of not the meta-analysis, we're going to, this next year, we're not doing a meta-analysis. Again, we're going to focus more on that qualitative approach to research and focus on on narratives around traditional healing for the traditional food programs at UIOs, as well as some of that research that's out there that is qualitative, and try to review that and summarize that for everybody.
Great, thanks, Nala. And then I guess just expanding on that for Janelle and Andrea, what challenges or successes have you found in funding some of the more traditional approaches to healing within your organization?
I'll go ahead. So I think, like Nala had mentioned earlier, it is it's not a group counseling. However, being a UIO and overseen by a Western agency, our Department of Health Services, that is a code where we have had to use as far as our outpatient services. In their residentials, we are per diem. And so there's that flexibility there. And we're able to acknowledge that group is the cultural group. So until our states become more open to getting that code specifically for traditional healing, we work with what we have.
Great. This is an interesting question. I am currently working on a curriculum to indigenize the medicine program at a local university. Would your organization be receptive to providing students knowledge and experience of indigenous healing practices so that they learn what is available for the patients? Or do you do any work with medical students or nurses or other types of clinicians?
So we actually work with a lot of different entities in providing internships for nursing. I think we would be open to also educating on that matter as well.
Great. Any more questions? Feel free to put them in the chat or mute. We can probably take one more. And thank you everybody for these great questions and discussion. All right, well, if there are no more questions, we will move on to the next slide. So we appreciate everybody's time today, and we also appreciate the efforts to help shape future events here at NUCUI. So if you have a few minutes, please scan the QR code or click the following link, and you'll be taken to our brief survey. If you don't have time to do it today, we will send out the link and the QR code as well when we send the slide deck and the recording. Feel free to share the slide deck, the recording with your colleagues or friends and people that might be interested in this presentation. And next slide, please. So today is the first of the month, and we have a lot of really exciting events coming up here at NUCUI. Next week, we will have a vaccine equity presentation, vaccine equity path to vaccine equity. On the 15th of the month, we will have a webinar on MMIP consent training. On the 30th, we'll have our last session for our behavioral health community of learning session, which will be on culturally responsive care for sexual assault survivors. And on December 7th, we will be hosting an open forum, building bridges, building trusts on COVID-19 insights. Molly has dropped in a link to all of our events, and then we will have more events coming in the new year as well. Last slide, please. Thank you all again for joining us today, and we want to again thank our speakers for sharing their wisdom, their insights, and all the hard work they do. So if you could please just show a clap of hands or another emoji. We're super appreciative for them taking time out of their day today, and appreciative of all of you for joining us for this great presentation. And with that, we will close the event, and I hope everybody enjoys the rest of their day.